Here's the problem when it comes to medical service. It's a lack of clarity when it comes to billing. We've talked about this many times, as have so many people, because, can you imagine paying thousands of dollars more for surgery at one hospital over another because the one hospital does not post its pricing? I mean, that is a big concern. Why would you do that? Answer is you probably wouldn't. Joining me is Andy Mangione, Senior Vice President for AMAC. That's the Association of Mature American Citizens, the conservative version of an organization for those over the age of 50. Andy, welcome to the program.
Good morning, Steve. Thanks for having me.
Good to have you, Andy. Glad to have you here. So how do we we've had these conversations on this program. People talk about it all the time. If there were just truth in billing, if we knew what we were paying for and pick your service, and it wasn't just we go to the hospital and spin the wheel and hope for the best, because that's kind of the way it works right now. You have no idea what you're paying for anything. How do we get past that?
Price transparency. And the president is taking a hard look at this. If everything was transparent as the sticker price on an automobile or the price of a house, not only would healthcare prices drop, but you would empower patients. And we're talking, emergency situations are what they are. But if you have to have a knee replaced, why shouldn't you be able to shop 4 or 5 hospitals in your hometown, see who's got the best price, who offers the best service, and then make an informed decision and take care of yourself? This is where the president wants to take us. But there's a strong lobby that's fighting against this.
That's what we do with every other purchase, isn't it, Andy? I mean, we look at see what's out there. We might go with the cheapest. We might go with something we like better because it has some features that we're willing to pay more for. Maybe the hospital's a nicer facility. It's closer to our home. Maybe we're willing to pay for that convenience. But if you don't know what the price is at all, you're just operating in the dark. And I think it's important that the president looks at this. Now, on the other side of this, my concern is I don't like government price controls pretty much anywhere. I don't think the government should come in. This is the most. This is one size fits all. That's a dangerous place to be as well, is it not?
Absolutely, and especially, price controls are bad with regard. Government price controls always are in the past, but we've seen in other countries consistently lead to rationing. No, we do not want any mandated federal price controls, particularly in private health care.
Well, let's talk about AMAC for a second and your role in pushing for some changes. For anybody that doesn't know, tell them what AMAC is, first of all.
AMAC is a right-of-center member benefits organization with a business model that's identical to the other folks, the AARP people. So we're a member benefits group, but we're a right-of-center group, and we tell you that up front. The premise of our mission statement, Steve, is faith, family, and freedom. We advocate for lower taxes. We want to curb out-of-control spending. We believe the Constitution is the greatest document ever created by man. We believe in religious freedom. We support the Second Amendment. We tell you what we lobby for, and we lobby on our members, and they drive our decisions. So we're a member organization. We don't sit around a room and pick and choose the issues that we're going to support. Our members tell us that. And we started about 13 years ago, and we built AMAC into an over 2 million member organization that has members in all 50 states. We are experiencing a surge in membership. It only costs $16 to join AMAC, and it covers your household. That's for a year.
Right.
And as I mentioned before, we're experiencing a huge surge in membership.
A counterpart or a counterbalance, maybe, a counterweight to AARP is the way you put it, and I think that's a fair way to put it. And with more than 2 million members, you start to have some clout when it comes to lobbying for transparency in medical bills, for example. So you've got some pull, Andy.
Yes, we do. It's been a long road, but yes, we do. We have I'm part of the team that goes to Washington. I was in Washington last week. People there know who we are. We average about 4,500 members. That's an average per congressional district. So when I walk into a congressional office, some districts have as many as 10,000, depending on the state. But when I walk into an office and talk about those types of numbers, the member of Congress realizes, number one, that there's an alternative that they can tap into when they want to speak to this demographic, and also there's a voting block of AMAC members in their district.
Do you think people realize that there's an alternative to AARP? I mean, they've been out there for so long, and they're their mission, I guess, is pretty well known by a lot of folks in many regards. But I think that the thing that people don't realize about AARP that you're being upfront about with AMAC is that they lobby too, and they often lobby on the left side of the ledger for different pieces of legislation, right?
It's interesting that you say that. We would love to work with AARP, Steve. We find ourselves about 180 degrees on the other end of the spectrum with regard to how to solve the problems that are facing America. Let me give you a quick example. Last year, the president issued a rebate rule where he wanted pharmacy benefit managers to share the rebates they received from pharmaceutical manufacturers. They wanted to share these rebates with Medicare beneficiaries at the point of purchase to lower their out-of-pocket expenses. We thought this was a good idea, and we supported it. AARP, their leadership, despite their members supporting this, lobbied against it. So I think that gives you a good indication of where they are in the political spectrum.
Yeah, and let's be honest, plenty of folks, and in fact, I would hazard a guess, the conservatism is stronger in people over 50 quite clearly than it is in people under 50 based on, I don't know, watching the debate in Nevada last night, for example. It gives me the impression that maybe people over 50 have a tendency to be more conservative. Call me crazy, Andy, but that's where I'm going with it.
I'm not going to call you crazy, Steve. I think that as we get older, we've been paying taxes for a long time.
Yeah.
At least on the fiscal sense, on the faith sense as well. But yeah, I would say that's a safe observation.
So besides the push to have more transparency and honesty in pricing when it comes to health care issues, what other sorts of things do you dig into at AMAC?
We dig into the solvency of Social Security. The last thing we want to see to make Social Security solvent is a tax increase, and we've crafted a plan that would make Social Security solvent for generations without raising taxes. It does call for some structural changes, some courageous structural changes, but it doesn't cut benefits. Okay.
Let me ask you about that. What kind of structural changes? What would you do to make Social Security solvent for the next several decades or longer?
The biggest component would be an age setback. So we would take a look at setting the age back to receive your benefits for a couple of years. We also would take a look at people's incomes. Some people call this means testing, but keep in mind that we're looking at making Social Security solvent without raising taxes. Right now, the millennials, and probably the folks in Generation Z, although they're younger, they don't believe that Social Security is going to be around there.
Of course, I didn't know either.
Our children and our grandchildren with increased taxes.
When I was in my 20s, I wasn't convinced that Social Security would still be around. It hits here, but it does need structural changes. And I think you're right about raising the age to collect Social Security maybe 1 month per year so it's not drastic, it's not a shock to the system, but I'm sure that's something you guys have talked about. I got to leave it right there. Andy Mangione, Senior Vice President for AMAC, the Association of Mature American Citizens. Real quickly, Andy, where can people go find out more right now?
They can go to our website at www.amac, that's AMAC.us, or they can pick up the phone and call toll-free 888-262-2006 to learn more about joining AMAC.
Great conversation, Andy. Look forward to having you back again. Really insightful, and I really appreciate you taking the time today.
My pleasure, Steve. Thank you.